Welcome to a brief overview of craniosacral therapy and how it may be employed as a wellness approach for attention and learning challenges. I'm Lisa Bowen, a massage therapist at Breathe Easy Bodywork in San Rafael, California. I specialize in craniosacral therapy and have a particular interest in the ADHD brain. I started exploring whether bodywork might facilitate more calm and ease. I found that there was reason to believe it could, and that's what I want to share with you today. First, please pause this video to read this important information about the benefits and limitations of massage therapy, and how statements in this video have not been evaluated by the FDA, and how anything said here is not intended as a substitute for professional medical or psychological advice. Craniosacral therapy is a bodywork approach fashioned after osteopathy by the late Dr. John Upledger in the 1970s. It's a gentle, hands-on method of evaluating and enhancing the functioning of a physiological body system called the craniosacral system. The craniosacral system is comprised of the membranes and cerebrospinal fluid that surround and protect the brain and spinal cord, which are essentially the organs of the central nervous system. Few body structures have more influence over our overall health and well-being than our central nervous system, and few body systems have more impact on our central nervous system than the craniosacral system. Every day, we endure stresses and strains, and the body absorbs them, but the body can only handle so much tension before the tissues begin to tighten and potentially affect the brain and spinal cord. Unfortunately, this can compromise the function of the central nervous system and the performance of nearly every other system in the body. A main objective of craniosacral therapy is to find and release restrictions and tension across the body, but particularly from the top of the head to the bottom of the tailbone, as you see in the picture at the bottom of the screen here. Ultimately, our goal is to allow the entire body to relax and self-correct. Here are some pictures of what a craniosacral session can look like. A lot of various hand positions on the head, for sure. I want to talk a little about cerebrospinal fluid, whose rhythm we're tracking with our touch. Cerebrospinal fluid is the blood source for the brain and spinal cord, which are held and protected together in an impermeable sac. The cerebrospinal fluid is specially created from blood as it enters the sac. The brain and nervous system require a superfluid and fuel. Although the brain only comprises about 2% of our body weight, it consumes 20% of the energy produced by the body. Healthy cerebrospinal fluid is free of red blood cells, and at most contains only a few white blood cells. It's similar to plasma. The craniosacral rhythm is a reflection of the cerebrospinal fluid filling and expanding the sac, and then being reabsorbed into the bloodstream until more is needed and there's a signal to fill again, in a continual cycle of flexion and extension. The rhythm is palpable throughout the body, even in the arms and legs and feet, just like the pulse. Where we feel the craniosacral rhythm anywhere in the body, there's movement and flow. Where we can't feel the rhythm, the tissues are restricted. Here the therapist is performing an ear pull. The intention is to use the ears as a lever to release tension in the horizontal membrane of the brain. This picture illustrates the vertical and horizontal membranes of the brain. When we're touching the face and head, we're working on releasing tension of the tissue underneath. Take the example of the ear pull in the previous slide. The horizontal membrane, called the tentorium cerebelli, is at about ear level, so you can start to understand that while we're gently stretching the ears, the actual intention is to stretch out this membrane. This membrane divides the occipital lobes of the cerebrum above from the cerebellum below. This diagram doesn't show well that there are various twists and turns of the membrane that create sinuses where fluid flows throughout the brain, delivering oxygen and nutrients and taking away waste. The membrane is attached to the skull at several points. This shows a release of the respiratory diaphragm. Tension anywhere in the body can be the source of dysfunction above or below. So, craniosacral therapy, or CST for short, might be considered a good modality to address attention issues and learning challenges, since so much of our work surrounds the brain and head and spine, prime elements of the nervous system. That also makes it relevant for stress release. Next, I want to explore the ADHD brain, and then finally, I'll talk about the CST approach for attention, focus, learning, and behavior issues. Diagnoses of ADHD have climbed dramatically in the U.S. in recent years, according to data from the Centers for Disease Control and Prevention. In 2003, almost 8% of children between 4 and 17 had received an ADHD diagnosis. By 2011, that rate had risen to 11%. 60% of children with ADHD, or 8 million people, carry the disorder into adulthood. Here's an illustration of what researchers are discovering about the ADHD brain. This is all possible since they've mapped out behaviors and tasks that each brain part contributes to. Of course, lots of questions remain. Scientists and doctors are asking, is it a behavioral malady or a neurological one? Is it caused by head injuries or perhaps birth experiences when the head and spine experience compression through the birth canal? Dr. Daniel Amen, a neurologist who runs clinics around the country, has identified 7 different types of ADHD, each with its own unique symptoms, brain function, and neurotransmitter activity, based on the large volume of brain imaging scans done at Amen clinics. So we can take that level of information if it's available for an individual, or just be informed by his or her behavior and what we know from brain science about where that behavior might originate when we offer touch therapy. Here's a summary of the ADHD brain, taken from medical research. There are citations to the studies on each of the following slides. The distinctions are delayed development, reduced volume of white and gray matter in several regions, fewer connections of brain cells within networks that regulate attention and emotion, and an imbalance of brain chemicals. Let's go through these one by one. Delayed brain development. In a landmark study from 2002, children with ADHD were found to have smaller brains than children without the condition. The trajectory of brain growth in ADHD children paralleled that of normal children, but at each age, brain size overall, and in most of the subregions, were smaller than normal. The study noted that the fact that brains of control in ADHD patients differ is significant because it demonstrates that ADHD has a biological basis with measurable physical manifestations. Researchers concluded that there are changes in patterns of brain growth from early childhood or in the womb. There didn't seem to be one way the pattern developed. It could arise from genetic differences, prenatal interference with brain development, or in early childhood, they said. By the way, this study used MRI equipment to scan the brains of 152 subjects. Some of the subjects were scanned up to 4 times over the course of the 10-year study. Their MRI scanner allowed them to examine not only overall brain volume, but also the sizes of different brain subregions and to calculate the volumes of gray and white matter compartments in frontal, temporal, parietal, and occipital lobes, as well as basal ganglia and cerebellum. What did they find? The overall brain size was found to be 3% smaller in ADHD children. The largest difference observed was a 9% gap in temporal white matter, with the control children having more white matter. The study report was encouraging. Quote, "The message for parents is this. What we found is a brain difference in those with ADHD, not a brain defect," study researcher Jay Gied, MD, Chief of Brain Imaging at the National Institute of Health's Child Psychiatry branch, told WebMD, quote, "We never found any damage to the brain in those with ADHD, no foul play or damage or funny business of any kind. And many children grow out of the condition as they age and brain development catches up." Reduced volume of white and gray matter. What's happening here? In a nutshell, gray matter makes up about 40% of the brain and consumes 94% of oxygen in the brain. Gray matter is the part of the brain that does the processing or thinking in the cortex, the area of highest functioning. White matter makes up the other 60% of the brain and are neurons in the center of the brain that allow communication to and from gray matter areas and between gray matter and other parts of the body. White matter functions by transmitting the information from the different parts of the body towards the cerebral cortex. It also controls the 24/7 functions of the body, the autonomic functions like temperature, blood pressure, heart rate, plus dispensing of hormones and the control of food, thirst, and emotions. Another factor in the ADHD brain is fewer brain connections among brain cells within networks that regulate attention and emotion. Finally, there's an imbalance of the brain chemicals dopamine, noradrenaline, serotonin, and glutamate in people with ADHD. These brain chemicals moderate emotions and mood, among other things. Now, let's explore the craniosacral paradigm, then its approach to brain health, to explore the question, can craniosacral aid the ADHD brain grow and work more efficiently? In the craniosacral paradigm, these are the assumptions made. Structure and function are interrelated, the body is a unit, the body is self-correcting, and movement is health, stasis is disease. First, structure and function are interrelated. All parts of the body function in relationship to their structural formation. When a structure is compressed, overstretched, or otherwise misaligned, function becomes impaired. Then, the body is a unit. Everything affects everything else. All systems are connected to one another, and the source of a problem isn't necessarily where you feel the pain or discomfort. Then, the body is self-correcting. There is an innate ability of the human body to heal itself. When the skin is lacerated, this self-correcting mechanism responds with an elaborate process to close the skin. Immune responses and inflammatory responses are also indicative of the body's self-healing abilities. The craniosacral approach involves facilitating or enhancing the body's own natural capacity when traumatic or disease processes become overwhelming for the system. We craniosacral therapists don't see ourselves as healers. We're facilitators, working under the body, mind, spirit's instruction to help clear the road so the body can do what it needs to do. Movement is health. Most therapeutic body work is concerned with identifying stuck places and reestablishing flow. Swedish massage, deep tissue, craniosacral, no matter what you do, they all look very different, but the intention is the same, to increase the flow of oxygen and nutrients in, waste out of the tissues, but by very different means. Now let's start exploring specifically how we craniosacral therapists look at the brain and how we can possibly help facilitate growth and self-healing. The late Dr. John Upledger, considered the father of craniosacral therapy, conducted a large study at Michigan State University in the 1970s where they studied brain restriction patterns of kids whose families and teachers believed they had learning and behavioral difficulties against a control group. The research was undertaken to determine if there's a relationship between restricted mobility of the craniosacral system and developmental problems in grade school children who have learning disabilities and emotional impairments. Upledger created a standardized craniosacral examination for a mixed sample of 203 grade school children. They tested for 19 potential restrictions of the soft tissue, many of the same things we do in a craniosacral session to evaluate the quality of someone's craniosacral cerebrospinal rhythm to determine how and where to start manual therapy. Upledger's conclusions? The results supported the existence of a positive relationship between elevated total craniosacral motion restriction scores and the classification of not normal, behavioral problems, and learning disabled by school authorities, and of motion coordination problems. There was also a positive relationship between an elevated total craniosacral motion restriction score and a history of an obstetrically complicated delivery they found. This whole study and the potential areas of restrictions are published in Upledger's first book, CranioSacral Therapy. Finally, let's take a look at craniosacral therapy as a wellness approach to attention and learning challenges. How could craniosacral therapy address small brain size and slower growth? Craniosacral therapy concerns itself with increasing fluid flow in the central nervous system, that's the brain and spinal cord, and throughout the body. This increases nutrients in and waste out, giving the body the best chance possible to grow and thrive. To discuss further, for each task a person undertakes, multiple sites and integrated pathways within the brain are required to operate in harmony for normal function to occur. Often, in cases of ADD and ADHD, some of these areas are performing at abnormally high, hyperactive, and/or low, hypoactive levels. What could cause this type of dysfunction? It might well be a lack of fluids moving within the brain tissue. Dr. Upledger regularly said this. It's essential for fluids to move in an unrestricted manner throughout the brain for it to perform optimally. Fluids, namely blood and cerebrospinal fluid, transport the vital and essential elements required by the cells, so they can function efficiently and in synchrony with other cells and constantly flush out waste products and toxic irritants. When the delicate cells are unable to receive what they need, or they're unable to live in an environment free of toxic waste products, dysfunction may occur. After the stress of compromised fluid flow is relieved, the areas of the brain that have been overactive and/or underactive can normalize, Dr. Upledger believed. Upledger's team found tight tissues in the meninges of kids with attention, focus, and behavioral issues. The meninges is the impermeable sac that lines the skull and vertebral canal and encloses the brain and spinal cord. Back to the last point, structural restrictions in the body can interfere with the normal movement of fluids. CST, as a gentle, hands-on method of care, is highly effective in relieving adverse strain patterns and restrictions to naturally enhance brain function. Craniosacral therapy releases tension and lines of tension in the soft tissue, particularly around the brain and spinal cord, but not exclusively. There can be tension in the foot or knee or pelvis, for example, that affects points higher. After CST, the results are often a central nervous system of greater balance and mobility in a body that's able to perform better. By helping the body make the biomechanical corrections necessary to allow the brain to function at its best, craniosacral therapy can help relieve ADD or ADHD symptoms. Releasing tight tissues in the meninges to improve brain function reflects all the aspects of the craniosacral paradigm. Structure and function are interrelated. If the structure is impeded, function is poor. The body is a unit. If the meninges tissues are tight, the effects are going to be felt in many ways. The body's self-correcting. Release tension and the body can repair itself, grow more, grow faster. Movement is health. Stasis is disease. Here's a photo of the bottom of the skull, and I picked it to show the holes where the spine, blood vessels, and nerves pass through. The large hole with the arrow pointing to it is the foramen magnum that accommodates the spine. Abnormal strain for any reason upon openings and vessels can compromise normal fluid flow into and out of the brain. As a prime example, approximately 85% of drainage out of the brain occurs through two vessels that pass through two small openings, the jugular foramina, and become the jugular veins. Sometimes stressful physical events such as the birth process, trauma, or whiplash can cause the base of the skull to jam forward on the top segment of the spine. When this occurs, it places strain on the bones at the base of the skull and the membrane layers within the skull, especially in the area that forms the fluid brain drainage openings. The neck muscles also chronically contract to prevent further jamming. This often will maintain the compromised position of bone and membrane, even for a lifetime. What happens when such adverse strain patterns are placed on the jugular foramina and the jugular veins? Abnormal vein pressure can occur, which decreases drainage and causes fluid back pressure to build up in the brain. Such pressure can lead to cell congestion, intracranial toxicity, abnormal pressure on cells, and diminished blood flow to the brain. Stress such as this placed on the brain cells may cause them to react by becoming hyperactive in response to the strain, or hypoactive due to the injurious condition, or the same cell or cell groups can be hyperactive at some times and hypoactive at other times. Any of these responses can lead to a myriad of conditions, such as headaches, motor planning issues, speech issues, and one or more of the principal characteristics of ADD and ADHD, inattention, impulsivity, and hyperactivity, according to the Upledger Institute. This illustration shows a technique we use in craniosacral therapy to gently separate the spine from the foramen magnum holes if we don't feel the craniosacral rhythm there. We just hold our fingertips gently there until the muscles soften, then raise the head into the platform, for adults only, that's a feature of many bodywork styles to create space and relieve neck pain, and actually pain anywhere in the system due to a lack of flow at this important junction. We use different techniques for children who are still growing. Another thing craniosacral therapy can do for the ADHD brain is relax the nervous system. The ADHD brain has been called a differently wired nervous system, and CST has been nicknamed massage for the nervous system, relaxing from the inside out. Along the same lines, in the ADHD brain, the reticular activating system is commonly stuck on high. That's related to the fight or flight state. Craniosacral therapy is designed to relax the nervous system and put it into rest and relax parasympathetic mode. So in summary, I want to encourage anyone who's interested to explore craniosacral therapy as a wellness approach for attention and learning challenges. It's gentle, non-invasive, and complementary with anything else you might be doing, including using medication or not. Thank you so much for your time and attention. Please don't hesitate to contact me with questions or comments.